What do a squeak toy and a stress ball have to teach you about getting a mammogram? Come with us and find out.
I have it down here. We have all of what our patients change from the waist up off, everything off. Gown goes open in the front. We use our Dimensions device here, which is a 3D device to do the mammogram. So once the patients are changed, generally they let us know. We come right on in and we can do our standard views for the mammogram. We have the patients positioned as close to the machine as they can get.
Okay.
And we do compress the breast tissue. Now, the more compression we have, the better the radiologist has a chance of seeing through all that breast tissue.
Okay.
And so when we compress the breast, you can see the more we compress, the more we'll see. And the farther down we go,
all right,
the better it is.
I see.
And so you can see that these little balls are coming out because that is adequate compression.
Got it.
And so that's how we would know. But we always, of course, are careful for, patients and their comfort level. So we would always be mindful of making sure that patients are safe and okay.
Got it. But you want, what you're really looking for is for it to spread out as much this way to get the good picture. Is that right?
Mm-hmm.
For each person, it's a little bit different because, their shape, size, and
Right.
density, what they're going to be able to take. A lot of people with dense breast tissue or have fibrous cystic dense tissue can be cystic, and that can cause, any cysts going on in their breast, sensitivity. So we don't compress more than if they're not receiving enough compression, we try to gently encourage them to maybe take a little bit more. We just want to. And if they say no, it's a no, but we want the breast taught so that we can get the proper imaging. And that would show us more depth.
Oh, wow. Where would I go?
So this would be for a side view. And position yourself within the device. And then that's when we would, again, place that little, we have a pig now.
How much is my pig going to squeal?
Until we have enough compression for a great picture for the radio.
That's wild. How long does it take to get the actual image? Is it like when you're at the dentist and they go click and it's done?
It's about, it's longer than the dentist, so it's about 20 seconds exposure.
Okay.
Everybody back?
We're all safe.
So that's the tube sweeping. That's getting the tomo views. So over here, you're going to be able to see that this is how the radiologists are able to view it. Sorry. So slice by slice, basically.
Hi, I'm Georgia Spear. I'm Chief of Breast Imaging at NorthShore University Health System. I'm a breast imaging radiologist, so welcome to my reading room. One of the things that we would recommend our patients to do is know what their risk factors are for developing breast cancer. And how could you find that out? You would want to know if you have a family history of breast cancer in a first-degree relative that is either a sister, a mother who has breast cancer, and you'd want to tell your family practitioner. They would refer you to the high-risk clinic or our breast imaging center for further information, because one of the things that we do when we screen for breast cancer is we tailor our regimen based on a patient's level of risk. If a woman is 40 years of age and older, it is recommended that she comes in for screening mammography annually. We're really fortunate at NorthShore to have pioneered in a technology called automated breast ultrasound for supplemental screening. And we perform it on our patients who have dense breast tissue to help us, to aid us in detecting breast cancers that we typically would have difficulty seeing because of that breast density. We also would like to inform our patients that there really isn't a breast size that is too small for us to image for mammography for breast cancer screening. In fact, 1% of breast cancers occur in males, and we often see them in our clinic, at which time we would perform a bilateral screening mammogram to ensure that we could detect breast cancer if it was present. If a woman is considered to be high risk, she would start screening earlier. And it's really important for us to, again, assess her level of risk. Sometimes women can start screening as early as the age of 25 if they are of high risk, if they have what's called the BRCA gene, which would be determined by genetic testing, and it would be referral, again, by their physician upon knowing what their family history is.
My name is Claudette Jones. I have done mammogram many times. For the past 18 years since I've been in this country, I have done it 16 out of the 18 years. And I think mammogram is life-saving.
I'm Lynette Connell. I am 54 years old. And I actually happen to be a physician here at NorthShore. I'll be honest, getting my first mammogram is something I delayed, but I finally did it because I'm a rule follower and I just kind of did what my doctor told me to do because I trusted her. And after a couple years of egging on, I finally got it done, and I realized, it really wasn't that bad.
Doctors will help us to figure out what needs to be done, and it can be done early. That helps us from going through the trauma of not being diagnosed early.
Why I continue to do it is because a dear friend of mine from college died a couple years ago from metastatic breast cancer. She's my age, has 3 beautiful children, and it just brought it that much closer to home. To appreciate is, as I've gotten older, I've developed cysts in my breast, and so what the mammogram and the ultrasound that I have to do afterwards has helped me understand is what I have is actually not cancer.
If we do mammogram annually, one, it helps us to identify if there's an issue very early, and we can be proactive.
It's important to take care of your body. Yes, it puts you in a really vulnerable state, but honestly, just knowing that you can take care of your health in a proactive manner so that you can be here for yourself, for your family, for your community, is really what matters.